What does an MRI radiology report show for osteoarthritis? Imagine having a detailed map of your joint that shows more than just the surface. That's what an MRI scan provides when it comes to osteoarthritis. It looks deep into the joint, revealing changes that might not show up on regular X-rays. This makes MRI especially helpful for understanding how the disease has progressed and which parts are affected. When doctors review the report, they look for specific signs of osteoarthritis. One of the main features is damage to the articular cartilage. This is the smooth tissue covering the ends of bones in the joint, and its breakdown is a key sign of osteoarthritis. The MRI can show if the cartilage is thinning, frayed, or completely gone, even in early stages. Bone marrow lesions, also called bone marrow edema, are another common finding. These appear as brighter areas inside the bone just below the cartilage, indicating inflammation or fluid buildup. These lesions often show up early and can be linked to joint pain. The report may also mention subchondral cysts, which are fluid-filled pockets that form in the bone beneath the cartilage. They usually have a hardened rim and tend to grow as the disease advances. Bone spurs, known as osteophytes, are bony growths that develop around the edges of the joint. These can cause stiffness and discomfort. Soft tissue changes are also important. Damage to ligaments like the cruciate or collateral ligaments in the knee can be seen. Meniscal tears or displacement, where the cartilage cushion in the knee is pushed out of place, are common findings. Inflammation of the joint lining, called synovitis, and excess fluid within the joint, known as joint effusion, are often noted. Sometimes loose pieces of cartilage or bone float inside the joint, which can cause additional pain or catching sensations. The report may also describe different patterns or types of osteoarthritis. For example, some cases show lots of bone spurs, while others have more bone marrow lesions or meniscal damage. Recognizing these patterns helps doctors decide the best treatment plan. The MRI report helps determine how advanced the osteoarthritis is and which structures are involved. This information guides choices like pain management, physical therapy, or surgery. Early signs like cartilage thinning or bone changes seen on MRI can lead to treatments that slow the disease's progress. The report uses specific terms like subchondral, which means below the cartilage, osteophyte for bone spur, and synovitis for joint lining inflammation. Understanding these words helps patients grasp what's happening inside their joint. In short, an MRI radiology report offers a detailed look at joint damage, including cartilage loss, bone changes, and soft tissue involvement. This detailed picture helps doctors make better decisions and tailor treatments to each person's needs.